Did you know that right now, millions of your cells are committing suicide? But don't panic, it's actually keeping you alive. Today, we're diving deep into the fascinating world of cell death, specifically apoptosis versus necrosis, and breaking it down for NEET PG, FMGE, and INICET exam preparation.
And it's such a crucial topic. I've seen countless students struggle with these concepts, especially in high-stakes exams like NEET PG.
Let's start with the basics. What exactly is the difference between these two types of cell death?
Well, think of apoptosis as a carefully planned retirement party. It's programmed cell death, organized, controlled, and actually beneficial for the body. Necrosis, on the other hand, is like a workplace accident, unexpected, messy, and always harmful.
That's such a clear way to think about it, and I've noticed this comes up frequently in exams.
Absolutely. According to recent exam patterns, questions about the morphological features of both processes are particularly common.
Can you break down those morphological features for us?
Sure. In apoptosis, you see very characteristic changes: membrane blebbing, cell shrinkage, and nuclear fragmentation. The cell basically packages itself into neat little bundles that are then cleaned up by macrophages.
Wait, so there's no inflammation with apoptosis?
Exactly. That's a key distinction that often appears in exams. With apoptosis, there's no inflammation because everything's contained. But with necrosis...
Let me guess, it's messier?
Much messier. The cell swells, bursts, and spills its contents everywhere, triggering inflammation. This is why necrosis always leads to tissue damage.
You know what's interesting? The word apoptosis actually comes from Greek, meaning falling off, like leaves from a tree.
That's a perfect metaphor. And speaking of exam preparation, let's talk about the pathways involved in apoptosis.
Right, there's the intrinsic and extrinsic pathways, correct?
Yes, and this is crucial for exams. The extrinsic pathway is triggered by death receptors on the cell surface, while the intrinsic pathway involves mitochondria and is triggered by internal stress.
And cytochrome C plays a key role in the intrinsic pathway, right?
Exactly. When released from mitochondria, cytochrome C binds to APAF1 to form the apoptosome. This is a high-yield concept for NEET PG.
Speaking of high-yield concepts, what are some common exam traps students should watch out for?
One major trap is confusing the characteristics of apoptosis and necrosis. Remember, apoptosis is ATP dependent, while necrosis involves ATP depletion.
That's a crucial distinction.
Another common trap involves caspases. Students often forget that these are the key executioners in apoptosis, but they're not involved in necrosis.
Let's talk about some clinical applications. Where do we see these processes in actual diseases?
Well, take pancreatitis, for example. Recent exam questions have focused on how necrosis in acute pancreatitis leads to severe inflammation and complications.
And what about apoptosis in disease?
Apoptosis plays a crucial role in many conditions. For instance, excessive apoptosis in neurodegenerative diseases or defective apoptosis in cancer.
That reminds me, isn't there something interesting about Reed-Sternberg cells in Hodgkin's lymphoma?
Yes. These cells actually represent a failed attempt at apoptosis. This concept has appeared in recent NEET PG questions.
Let's break down some recent exam questions. What topics keep coming up?
Based on the last few years, questions often focus on morphological changes, biochemical markers, and clinical correlations.
Any specific examples?
Yes, there was a recent question about identifying the earliest feature of reversible cell injury, which is important to distinguish from both apoptosis and necrosis.
And what's the answer to that one?
It's cellular swelling, but here's the key. Unlike necrosis, this change is reversible if caught early enough.
That's a great distinction. What other high-yield topics should students focus on?
The role of calcium in both processes is crucial. In apoptosis, it's regulated, while in necrosis, there's a massive calcium influx that damages the cell.
And what about DNA changes?
That's another key distinction. In apoptosis, DNA is carefully fragmented into specific sizes, while in necrosis, it's randomly degraded.
You mentioned clinical correlations earlier. Any specific examples that students should know?
Yes, take caseous necrosis in tuberculosis. It's a specific type that combines both apoptotic and necrotic features. This often appears in exams.
That's fascinating. Any other types of necrosis that commonly show up in questions?
Fat necrosis in pancreatitis and coagulative necrosis in myocardial infarction are both high-yield topics.
Let's talk about some mnemonics or memory tricks for students.
I like to think of apoptosis as A for arranged and necrosis as N for nasty. It helps remember their basic nature.
That's really helpful. Any other tips for remembering the differences?
Think of apoptosis as cellular recycling. Everything's packaged and reused. Necrosis is more like a cellular explosion. Everything's destroyed.
These analogies are so useful for understanding the concepts.
Exactly. And they help in answering those tricky exam questions that try to confuse these processes.
Speaking of exam questions, any final tips for our listeners?
Always read the question carefully. Look for keywords like programmed, inflammation, or ATP dependent to identify which process they're asking about.
And what about time management during the exam?
For these topics, questions usually take about 45-60 seconds each. If you're spending more time, you're probably overthinking it.
That's really helpful advice. Any common misconceptions we should address?
Yes, many students think all cell death is bad. Remember, apoptosis is essential for normal development and tissue homeostasis.
Like during embryonic development, right?
Exactly. It's crucial for forming our fingers and toes and for proper brain development. These examples often come up in exams.
What about the role of mitochondria? That seems to confuse many students.
Mitochondria are central to apoptosis through the intrinsic pathway, but in necrosis, they're actually early casualties of the process.
That's a crucial distinction for exam questions.
And remember, questions often focus on the reversibility aspect. Apoptosis is a point of no return, while early cell injury can be reversed.
Let's wrap this up with the most important takeaways for our listeners.
First, always remember, apoptosis is programmed and controlled. Necrosis is accidental and chaotic.
And the inflammatory response?
Right, no inflammation in apoptosis, always inflammation in necrosis. That's a guaranteed exam point.
What about the energy requirement?
Apoptosis needs ATP. Necrosis occurs when ATP is depleted. This is another high-yield concept.
This has been incredibly informative. Any final words for our listeners?
Remember, understanding cell death is understanding life itself. Master these concepts, and you're well on your way to a C in your exams.
Thank you for joining us on Copilot Podcasts. Remember, whether it's organized retirement or workplace accident, understanding cell death is crucial for your medical career. Keep studying, and we'll see you in the next episode.